Hello, everybody. Welcome to our info session. I'm so glad you could make it on a beautiful but somewhat chilly day. So as Erin said on the right, if you have any technical difficulties, feel free to be in touch with her. And I will start the presentation. So my name is Eleonora Bartoli. I am the director of our graduate program in counseling, and I'm also the coordinator of our trauma concentration. In the program, I teach a few courses. I teach an introductory theories and technique course that students take usually in their second semester or so, and is a joy to teach. I really love the course. And I also get to teach two of our trauma courses, evidence-based treatments of trauma, and also trauma advocacy and social justice. This is my 10th year with the program, and I love my job, so I hopefully will get to make you see all the wonderful things that we do and that answer all your questions. So in terms of what to expect from our hour-ish together, I will first introduce you to our program and tell you a little bit about who we are and what we do. That will probably be about 20 minutes. You know, I'm a teacher, so I tend to talk, so I'm hopefully we'll be able to stick to that. And then we'll have plenty of time for a question and answer session. You can either type your your questions as you see there is a nice chat space on the right, or you can also use your microphone, but we are recording the session so that other people can view it. So if you don't want people to hear your voice, then don't record it, but sometimes it might be too much to type a long answer. So absolutely at that point, feel free to use your microphone. So what I'm going to do now is share my screen so that you may view the PowerPoint as I guide you through it. Okay, so I want to start by just making you notice that we have a slogan, is best practices and justice with heart, which I hope you will see by the end of the presentation why our program embodies those words. We really aim at teaching you the absolute best and most recent that the field has to offer. We want you to become agents of social change and make a real impact in the communities that you will serve. And we also want you to never forget the power of that relationship with your clients. So the heart is what's going to make everything else come alive. So the first thing that I want to say is that I'm absolutely delighted that you are thinking about counseling as your field of study. It is an incredibly empowering and rewarding field to be in. It's a place where you can make a real difference in someone's life and truly allow them to reach their highest potential. And it's an incredibly meaningful field to be in. And the other good news is that you can work in a variety of settings. So students graduating from our programs work in mental health agencies, sometimes in hospitals, private practices, schools, not-for-profit. And sometimes you think of counseling as just delivering individual, family, couples, group therapy, but counseling is much more than that. You can act as a consultant in schools or, again, not-for-profit. You can work as a client advocate. You can work in family court. You might manage, train, and supervise future counselors. There's a lot of things that you will do as a counselors that goes beyond what is thought of as traditional therapy. And so hopefully you'll see how our program prepares you for all of those settings and all of those functions. So let's get right in what it takes to become a licensed professional counselor in Pennsylvania. Now, state licensure laws are different by state. So I'm going to tell you about Pennsylvania. So in Pennsylvania, you need 60 credits. And of course, it's always, every state does a little bit different. So in Pennsylvania specifically, your degree has to be of at least 48 credits. And you can do 12 credits sort of a la carte or take them outside of your degree if you want to. Most programs do offer 60 credit degrees. There's lots of reasons why you might want to do a 60 credit degree all at once. But let's say that you have credits from other institutions and you want to make good use of those credits. That would be a good way to do a 48 credit and use those credits is without having them not count. The usually 60 credit program, generally speaking, takes 2 to 3 years, depending on the program and the pace of your life in general. In addition to the program, you have to accrue 3,000 hours of supervised experience. That's in addition to any practicum or internship sort of work that you might do within the program. And that's, again, for everybody. And then you have to pass a licensing exam, which for a lot of people is a national counselor exam, but it could be other exams as well, depending, again, on the state or on the licensure laws. So that's what it takes to be an LPC, as we call licensed professional counselors in Pennsylvania. So how does our program meet the licensure requirements? So we have a mental health counseling master's program leading to licensure, and we do offer the two options. We offer a 48 credit program and also 60 credit program. I would say most of our students do the 60 credit program, very few do the 48, and again, they do it if it makes sense to them. We also have an evening program, so our classes are in the evening, which allows you to have your full life during the day and then be a student by night. Our classes start at 4:30 and they end as late as 10 p.m. So it starts 4:30 to 7:10 is one of the classes, and 7:20 to 10 p.m. is another section. So you could take up to 2 classes at evening, and our classes run Monday through Thursday. You have part-time and full-time options, so you can take as little as 1 course per semester. You can take as many as 5. That's a lot. So most people, I would say, take 2 or 3. And it's a self-paced programs, which means that you take the program at any pace that your life needs to allow for. So that could be that you do it in as little as 21 months, that's less than 2 years, or you can do it in as long as 5 or 6 years. Again, most of our students choose a moderate pace, which is about 3 to 4 years, because they intend to work and intend to have lives outside of going to school. The good news is that you pay by the credit, so it doesn't really matter how long or short you make the program. You just pay for the credits that you take. So it's the same cost at the end, whether it takes you 2 years or it takes you 4 years. We also have summer courses, so you are maximizing the time of sort of flowing through the program. We are offering now a free preparatory workshop to study for the NCE, the National Counselor exam, the licensing exam, and that will be offered every year, every spring, so you can take it multiple times and feel really ready by the time it's your turn to take the exam. So there's lots of things that I would say make our program unique, and one of them is the variety of concentrations that we offer. And I think that the reason why we are able to do that is a fairly unique feature of a master's program, especially a master's program that is, as we'll tell you, is small by design. So I'll tell you a little more about that in a second. But we have a campus that is so rich in resources and other graduate programs that we can collaborate with, that it really allows us to provide this range of opportunities that otherwise might be difficult. So I think we have as many concentrations as I've seen any program have. In collaboration with the Education Department, we offer an applied behavior analysis and an autism concentration. In collaboration with the International Peace and Conflict Resolution Program, otherwise called IPCR, we offer the Mediation and Conflict Transformation Program. In collaboration with our Public Health Department, we offer a Community Public Health concentration, and then we offer completely within our department a Child and Family Therapy and mental health counseling concentration, and the trauma concentration. Now, the mental health counseling is sort of an umbrella concentration that allows you to pick electives from a number of courses and craft a program that meets exactly your interest and fosters all your passions. Maybe you don't have one, you have many. We also offer three dual degree programs in collaboration with the IPCR department, International Peace and Conflict Resolution, and in collaboration with the Public Health. So if you're seeking 2 master's degrees that speak to each other at the same time, you could have a counseling and IPCR double degree. You could have a public health or health education and counseling degrees. You can also, excuse me, you can also combine concentrations and do more than one. So more concentrations is more credits, of course, but the one that most students end up wanting to combine is a child and family therapy and trauma. With 63 credits, you get 2 concentrations for just one more course, because you're using the electives of each to complete the other concentration. But any concentration can be combined with another one. Okay. So this is the core courses. Given everybody might be doing a different concentration, we still have a number of core courses that everyone in the program takes. And these are the areas that everyone is going to be highly trained in. So assessment tools, clinical interventions, career counseling, diagnosing. From research to practice is you're learning what the research and the most up-to-date information in the field is, and you're learning to translate it into your clinical practice. Human development, you're going to learn a lot of evidence-based practices, ethics, multicultural counseling. I'll talk more about our multicultural curriculum, and you're also going to do practicum and internships. So applied experiences are central to what we do. And then there are all of our elective courses, which would not fit in one slide, so there are more, but this is a sampling of the kind of courses that you'll be able to choose for your electives. If you're in some concentrations, you will be absolutely taking some of these courses. If you're in a mental health concentration, you really get to pick and choose the ones that you will like. I don't want to go too fast and not let you absorb the slide. Okay. So there's another aspect, I think, of our program that is quite unique, and that is our integrated curricula. So what I mean by integrated means that it's not about, they don't just appear in one course, but they are sprinkled at very purposeful intervals throughout the program. So everybody coming to the program is absorbing all the pieces of this curricula just sequentially across the program. So the first one is the career development curriculum. There's something different between just taking courses and learning your skills, and then knowing how to market yourself and secure the job that you actually want to have. So the career development curriculum really allows you to learn how to integrate what you've learned and portray what you learn and communicate what you learn to be able to impress your interviewers and obtain the job that you actually want to obtain after you graduate. And that happens through a number of avenues. Some components are in courses, some components are in advising, some components are extracurricular, and you'll learn all about it as you move through the program. Another integrated curriculum is evidence-based practices. So very intentionally, we have placed training in evidence-based practice throughout the program, where you're learning components of practices and techniques, and then you're learning how to put them in a row in very sequential ways to help the clients improve in certain ways. So that also something everybody out of the program, regardless of concentration, is going to have a very strong foundations in evidence-based practices. I would say probably one of the most unique curricula out of within our curricula is the multicultural counseling curriculum. Most programs end up having one course in multicultural counseling. Our training spans the entire program. We not only have one course, but we have a series of labs, specialized multicultural labs in both self-awareness and knowledge, multicultural self-awareness and multicultural knowledge that appear throughout the program. And you're also going to hit a number of skills components throughout the program related to multicultural counseling. So we always tell our students, you'll be more trained in multicultural counseling than most of your supervisors, which is a great thing because you're going to be the one who are going to make up the field and transform it moving forward. So hopefully we are part of the movement that is going to transform the movement into a very multiculturally competent one. And last but not least, self-care. So when you're putting yourself into new experiences, and when you are learning new things, it also means that requires energy. So we can't wait to take care of ourselves until after we graduate. It's so important that for us to be able to be effective, that we fill our cup first. And once our cup is full, we can give freely to everybody else. So throughout the program, there's going to be activities embedded in your courses, and there's going to be components of the program that help you really learn how to support yourself as you're navigating a new path and learning wonderful new skills. Another unique aspect of our program is the culture of feedback. So we are very big on this. We don't do the program to you, we are doing it with you. And there are two main reasons why we really like to do that. The first one, because you have the best ideas ever. And so if we ask you for feedback about how things are going, we learn so much about how to be more effective in making our program really strong and powerful for our students. But also I want you to come out of our program feeling quite empowered in trusting your voice and trusting that you can make a change in the systems that you're going to be interacting with. So by learning to change us, you're actually learning how to change the world around you. And so once you go out in the world, you will have fine-tuned your advocacy skills and really are going to be trusting yourself to make a difference. And then another part that is very important to us, another component of our curriculum that's very important to us is self-awareness. As a dear colleague of mine always says, we are the tools of the profession. That's back to the heart, doing your work with heart. We have to know how to put ourselves into the process and how to be able to really communicate in the best possible way and reach our clients. And for that to happen, we really have to know ourselves quite well. So the program as many aspects of it that foster your level of self-awareness, not just multiculturally, but as a whole person. So we ask for a lot, so we give a lot, right? So how do we support our students? In a number of ways. So we have, first of all, a really intentional advising and mentoring process. You're not going to get one advisor, you're going to get 4 advisors. So the first advisor is a program advisor, and that's who I call the one and only Carol Lyman, who will sit with you and craft program plans designed specifically for you. She will mold what our program requires onto your life by making sure that it fits what you need, and then make sure that the pace at which you're taking the program really is what your life can allow for. And she also mentors you through your practicum and internship application process. She guides you through that whole process. In addition to her, you also are assigned a faculty mentor. The faculty guides your academic progress throughout the time that you are with us. So there are formal and informal meetings that schedule regular interviews where you're reviewing your progress. The faculty mentor helps you identify your passion, helps you explore opportunities in the field while in the program, and the truth is even past the program. So the faculty mentor guides your progress throughout your time with us. You're also assigned 2 peer mentors. In the first semester, you're assigned a peer mentor that is a student who is more advanced in the program than you are. So they can sort of give you the inside scoop. What's it like to take that kind of class? Or where can I get a cup of coffee before my 7:20 class? Or any questions you might have as you're beginning to get acclimated to the program itself. At the end of the program, while you're in internship, you get an alumni mentor. That person is someone who's recently graduated from the program and can really give you a sense of what's going to happen as you launch yourself into your professional life. And that person is going to give you a sense of what it's like to move from a program to a job. And there are lots of activities you're going to do in that last year that, again, part of our career development curriculum, they're going to propel you into the next step. To launch you into the program as you start, you also have a day-long orientation where you're going to learn tools that are going to make you as effective as possible in navigating the program. And the good news is that these are tools not just for you, but these are tools you're going to learn, and then you're going to learn that there are counseling skills that are actually going to apply to your clients. So it's both the training for you and the beginning of your counseling career. We are big on saying we are growth-focused and not grade-focused. Your clients will never worry ever again about what you got as a grade in every class. What will matter moving forward is how much your skills are growing and how much you're growing as a professional. So we as faculty are very much growth-focused and grade-focused. We have to get grades, but really what's most important for us is guide you every step of the way to the next step. The next item gives me a lot of joy. It took a few years to put in place, but we have been able to secure funds for every student who matriculates in one of our degrees programs. So if you end up matriculating into a degree program, you are automatically awarded a $500 professional development purse, which you can use for any activity related to professional development, attending workshops, conferences, belonging to professional organizations, any opportunity that could make you an even better clinician and professional that complement what you're learning in the program. We have found a way to fund it. So that's yours once you enter the program. The other thing that is really important to understand before I talk about the last bullet item is that we are absolutely an applied program. So skills practice happens throughout it. We have beautiful training rooms. We do role plays throughout the program in almost every class. We have the practicum really early on, intentionally so. You're going to do a practicum early on in the program, and that's so that you can immediately see how everything you're learning applies directly to the work you're going to do. And we also have a course where you will learn specific protocols for treatment protocols. So you're not only going to learn techniques in a number of courses, but one course is going to be dedicated to learning specific protocols. So you're going to come out absolutely trained and ready to go from the moment you step out of the program. And last but not least, I want to sort of mention, for those of you interested in research, and I know some of you might be for a number of reasons, you might be aspiring to go on to doctoral programs, or you might be aspiring to managerial position and you want to do needs assessment or program evaluations. And so I would say at any one time, we have maybe a fifth of our program that is doing research in one form or other. It's absolutely not a requirement in any way, shape, or form, but is a wonderful opportunity if you are interested in it. So I just want to direct you to a page on our website that will describe the kinds of projects that we tend to do with our students. And I'll let you read the website page at your leisure, but I want to show you here the kinds of projects that we do with students. So on bullying, parenting, multicultural competence, mindset, program evaluation, LGBT training, acculturation, suicide, racial socialization, and others. Sometimes students join our labs, and at other times students come up with their own ideas, and we follow them and we do research with them. So I would like to tell you the wonderful people you're going to work with. So I'm going to again start with the full-time faculty, and I will let you read their profiles online at your leisure, but I want to point you to the right page. So Carol Lyman's front and central is going to be your program advisor, and then we have 5 other faculty. Full disclosure, Dr. Gillum, who is wonderful, is retiring this year. So it's myself together with Dr. Morrow, Dr. Lee, and Dr. Reed, who are your faculty members, and we have a variety of different interests in terms of research and professional expertise, so we are a good complement to each other, and we are going to be your faculty mentors. We also have a small group of wonderfully and incredibly dedicated adjunct faculty. Some are LPC, some are psychologists, and some are multicultural educators. So Dr. Ali Michael, for example, is going to be one of the folks you're going to learn from in your multicultural lab. Dr. Monica Campbell teaches your mental health, mental illness, which is a diagnosis kind of course. She speaks nationally and trains clinicians nationally on the topic. Elizabeth Byrne just recently won our PCA Outstanding Practitioner Award. So she's won a state award. And then Lois Keller, and she teaches internship. Lois Keller teaches our group course and sometimes some other courses. She works in an amazing agency that works with children who have been sexually abused. And then we have Matt Wexler, who is a school psychologist working in the Abington School District, who teaches our assessment course. So he's practiced everything that he's teaching you during the day, and then he comes at night and teaches the same thing to you. So all of us are active clinicians, except for our multicultural educator, and so we teach directly from that experience. And I would like to meet our students as well. So I want you to again point to the page on our website where you can read a little bit more about what our current students are up to. And please, by no means, do not be intimidated. These were students that not long ago were exactly where you're at. And so it's just by walking through the path and becoming engaged and investing yourself into a program that you end up choosing, these are the kinds of things that you might end up doing. And we also have wonderful alumni and alumni. which you can read about them as well. And this is the page where you're going to learn more about what they do and what they're up to. So you get a sense of where do you go after you finish a program. And my presentation would not be complete if there weren't a bragging corner, of course. So these are some of the awards that our program won just in the last 5 years. We won the PCA, the Pennsylvania Counseling Association Outstanding Program in Counselor Education Award. We were super proud of being recognized as one of the best programs statewide. The the Montgomery County Counseling Association Graduate Student Award, we won it 4 times out of 5 years. The PCA Outstanding Graduate Student Award 3 times out of the 5 years. And then again, the PCA Outstanding Administrator Award, we won twice, the last time for Carol Lyman, who I keep mentioning. And then Elizabeth Byrne won the State Outstanding Practitioner Award. And our students working together in a team also won a Service Project Award. This was actually the second time, it was only the first time in the last 5 years. We have a 100% passing rate on the NCE, and I would say with very high marks. Some of our students get as higher as 40% above the passing score, so they tend to do quite well. With that, I want to hear your questions and make sure that I answer your questions. So I'm going to stop sharing my screen, get back to my main screen, and what do I do? Oh, chat, there it is. Okay, so I'm going to have my keyboard ready, and I am very happy to answer accepted each year. Okay, so how many individuals are accepted each year? We're looking at a class of about between, I would say 25. It's a good guess. We have a part-time program, so it sits in classes more than number of students, but overall in the program we have about 80 students, which gives us the ability as full-time faculty to really cater to them individually very concerningly. What kind of opportunities does your program offer if you wish to work with veterans, military populations? We actually don't, at the moment, our program does not prepare you to work with the VAs. It might change in the future, but that's the only population that at this point we cannot work. If you want to work in VA specifically, in the Veteran Administration. If you want to work with trauma, and even with veterans, but outside of the VAs, then the trauma concentration prepares you extremely well to work with trauma, complex trauma, and subclinical PTSD, fully clinical PTSD. You're going to come out being able to work with any trauma, any population with whom you might have to discuss trauma. Beautiful question. What type of theoretical orientation does the program have? And this is sort of a strange question, but I mean, strange answer. The question is beautiful. There are 2 main orientation that I would speak about, and that is evidence-based practices and multicultural counseling. What I mean by that is that you will learn every technique from every theoretical orientation that is proven to be effective. So we don't just stick to one, because what if that one doesn't work, or if that one is not adequate enough to meet the client's needs, then what are you left with? So we collect all the evidence-based practices, the best the science has to offer, and we teach you every one of them from all the perspectives that are available to us. And we don't think of counseling as separate from multicultural counseling. It's one and the same. And so everything you're going to do is also going to be infused with the ability to respond to diverse populations. Where am I at? Okay, can you talk about the application process and requirements? Absolutely. So the application process involves some essays, I believe 3 essays, and it also involves collecting 3 letters of recommendations and filling out an application. Erin Carton and Tiffany Grant are marvelous at guiding through the whole process step by step. They are you will have a very easy time through that process. And then we review the applications and we decide who will be coming in for an interview, and we have dates scheduled for the spring to come in for interview, and then you will be told fairly soon after the interview process whether you're admitted in the program. And let me know if your follow-up question, I hope I answered your question. And out of how many applicants is that, and how many people apply to the program each year? It's sort of difficult to completely describe because the numbers change. Let's say that we get about, I'm going to really estimate 100 some applicants, maybe, it depends on how many we interviews, but I would say maybe we interview about 60 or so of them, and then about another maybe 60% of them will attend the program. This is really sort of guesswork. I can get you better numbers if I do some math. Let me know again if you have a follow-up question. Different payment, also, could you discuss different payment options for out-of-state students? Well, we're not a state school, so I don't think that the payment schedule is different, but I will ask maybe Erin or Tiffany to help you connect with the financial aid office, who can answer those questions much better than I can. It's a very good question, but I don't think there's a different payment schedule at all for in-state or out-of-state. Does the department prefer students directly out of undergrad or students who with work experience? Both. So it's we don't have an explicit preference. We just are assessing where you're at, and if you're ready to start your program, you're ready to start a program. It's more important that this is the right time for you to engage with it than any specific avenues to reach your goal. If you feel ready, go for it. If you feel that you want to really get a taste of the program, of the field before you jump in, then do that so that once you apply, you're really clear that's what you want to do. But the program itself has built in a lot of applied experiences, and you can do multiple practicum as well, which we encourage if you're not working in the field, and that sort of prepares you to reach your goal no matter what. Do you have to send in a resume with your application? Thank you for the question. I forgot. It would be very helpful if you did. I can't remember whether that's actually mandatory or not in the application process, but we really appreciate it. It's very helpful for us to have that. Thank you, Erin. Erin just answered your question a little bit more. Application deadline for fall is January 15th. The application for spring is September 15th, and you can apply online at that address. Is this program double degree? So we do have 3 dual degree programs where they give you're going to earn 2 completely separate master's programs. We have a dual degree program with international peace and conflict resolution, and 2 other dual degree programs with public health and health education. That's if you want to do 2 completely separate degrees. We also have concentrations within our program, and that's within 1 degree. Does the program require the GRE? No, we don't require the GRE unless your undergraduate GPA is less than a 3.0. But if your undergraduate GPA is at least a 3.0, then you don't have to get the GRE. The GRE or MAT, we ask you for those. If your GPA is less than 3.0, I'll give you a chance to demonstrate in a different way that you have a certain amount of academic skills. But don't, again, let grade stop you from applying. We look at the whole person. We have admitted folks who have a 2.8 and we have, or less than a 3.0, and we have rejected folks who might have higher GPAs. It's really whether you're a fit for the program and whether you're a fit that we think that we can train you specifically for the profession. Do you have any further tips for the application process? I would say I'm the one who reviews most of the applications, so you're talking to the right person. I would say what I really look for is essays that give me a flavor of who you are. So that, I have a sense that you understand that this is what our program is about, but also that you know why you're entering the field and you know why this is a good match for you. So I would say writing about a page or so, it's good, or a page and a half, just about, 2-3 paragraphs is plenty. But make sure that give it to a friend and say, if you read this, could you tell it's me? So avoid the generic one. Just make sure that we get a feel for who you are. So hopefully that's helpful. But again, ask me a follow-up question if I'm not fully answering your question. Does the department have a preference if the recommendation letters are all from professors or some from former bosses? So if you're recently enough graduated, we would really like 2 of the 3 letters from faculty members, but we would love to have 1 letter from your employer or from a supervisor, especially if you're in the field, or someone who could attest to your professional skills outside of academia. So 2 and 1 usually is what we look for, but if you've graduated 10, 15 years ago, it might be really difficult to get that many academic letters, and so it would be fine to also have 1. Erin answered the tuition from out-of-state question. So Rachel, we do not have different tuition for out-of-state students. We do offer payment plans for any student. And there's a link that I can't read, unfortunately, for those of you who are on the phone and not on the computer. But I'm sure, again, Aaron and Tiffany can guide you very beautifully to that information. What is the total hours for this program and duration? So this is we have both 60 credit option and 48 credit option. Most of our students decide to pursue a 60 credit option. And the duration could be, again, as little as 24 months and as long as it takes for the program to fit your life. So you can make it a very concentrated accelerated program by doing it in slightly less than 2 years, or you can take a little bit more time and make sure that the rest of your life you can still work and do your family obligations and anything else that you might have on your plate. I would say the majority of our students take between 3 and 4 years. And then some students take shorter, some students take longer. It really depends on how what their life entails. And sometimes they change their minds. I should say sometimes people come in and say, you know what, my life opened up a little bit. I would like to accelerate the program a little more. It's more often the students say, you know, my life is complex and some more complexities sort of came in. And so let me slow it down. So you can change the pace of your program as you're going through the program. You don't have to, the pace you choose at the beginning doesn't have to be the one you keep throughout it. If the person is not accepted, is there anything that they can do to become accepted in the program? Sometimes it happens that maybe a person is not accepted, but they usually seek feedback. Sometimes they don't, but sometimes they apply again. And I can think of 2 students top of my mind that did not be accepted, were not accepted for any reason. We were not able to assess their skills adequately, maybe to the first interview. They came and spoke with us, got some feedback, and they both are some of our best students. We were very excited that they stuck with it, tried again, and got some more experience, or took a class not matriculated, tasted the program, got a feel for what it was like, and then come right back in. So what percentage of our students come directly from undergrad versus coming from the work field? I'm going to give you, again, an estimate from the top of my mind, and I would say it's probably 50-50. 50% of our students come straight from the undergraduate, and 50% has maybe a couple of years experience. That's probably of the people who have some experience. 2 to 3 years is probably the majority. And then we have those career changers. We do have folks in the 40s, 50s, and 60s coming back and taking courses and deciding to do what their passion is and the love of their life at that stage in their life. So we have the gamut. If called for an interview, does your program offer any further financial assistance? So we don't have scholarship per se. It's very hard to craft them for master students, but we do have that professional development purse. And again, the financial aid office will be able to tell you all about financial packages that you could access. And I hope they're really nice and very welcoming. So I'm hoping that you'll be able to get to talk to them. If our GPA is above 3.0, but still not very high, lower than 3.5, should we send our GRE scores as well, just in case? Don't worry. No, I would say no. Don't worry about it. You have plenty to work with, and don't spend more money or put more effort. This is already a process. I would say no. It is online or in class? Good question. Thank you. So it's a face-to-face program. We used to have a few online courses, and our students did not like them, I have to tell you, just because, you know, we're people. So we don't have online courses. However, we do have some courses have a few online sessions, which is also very good. As you can tell, a lot of things happen online, so it's good to know how to function online. But if you do some of our concentrations, especially the ABA and applied behavior analysis, the ABA, the applied behavior analysis, or the autism, those courses are online and they're offered through the education department. So there might be parts of your concentration courses that might be online, but all of our core courses are in person. Can you send in 4 recommendation letters? Absolutely. I would say 4 is fine. Don't feel like you have to send them anymore, but it's nice to have a variety of perspectives on who you are, but 3 is plenty. So don't feel like, oh, if I send 4, I have a better chance. 3 is absolutely fantastic, but if you want to send 4, it's absolutely fine. What kind of questions do you ask in the interview? Well, I can tell you. I will share my secrets, but let me tell you what we're looking for because that's fair. First of all, the interview process starts with a Q&A where you get to interview us because it's only fair that you really get a very good sense of who you are before we ask you questions. And by the time you've interviewed us for over an hour and is in a small group, so we all talk together, you get to meet a couple of faculty and Carol Lyman is there as well. And there's about 5 or 6 students. And then you get to really talk to us for a while. First of all, that makes everybody more at ease. And then by the time we turn around and ask you a few questions, you'll know exactly what we're asking them. It's obvious because it's all about our program. So we look for folks who have a beginning self-awareness. We look for folks who can absorb feedback and work with feedback. We look for folks who are interested in the beautiful multicultural world that we have around us. We look for folks who are also fit our specific program. There are lots of programs. So we want to make sure that what we have to offer is exactly how it really supports your learning and your style. So that's what we're looking for in the interview process. And I'm happy to answer more questions, but I can't give up quite the interview questions. What does a typical class schedule look like for an incoming student? So it really depends on you. It could be 1 course or 2 courses. Again, we have 2 courses offered back-to-back every night. So you could have maybe if you take 1 course, it's just a 4:30 or 7:20 p.m. course. Or if you take 2, could be back-to-back on the same night or could be on 2 separate nights. So we offer 1 section of the course each semester. So whenever that course is offered, that's when you could take it. We don't have multiple sections. That's the only shortcoming, I would say, of a small program, that you don't have multiple sections of the same course. The good news is that you get a lot of attention and good training. So a typical, you could take a course at 4:30 on a Tuesday and another one at 7:20 on a Thursday, if you're taking 2 courses or any variation on that theme. Again, let me know if I'm not fully answering your question. Is there an opportunity to study CBT specifically in the courses? Oh, absolutely. CBT is one of the most well-known, most well-studied and used evidence-based practices. Not only you will learn it across several courses, certainly 3 core courses will cover CBT, and one of those 3 will actually cover an entire CBT protocol specific for depression. So you will learn how to apply it in a very systematic way, and but you will also learn other modalities. But plenty of CBT, absolutely. In the trauma concentration, what kinds of treatment therapy do you focus on? So, beautiful questions. You are very informed students. I love it. So in the trauma concentration, there are 3 main treatments that are evidence-based for trauma. One is copyrighted, so I can't teach it to you. You have to access it outside of any institution, and that's the MDR. But the prolonged exposure and cognitive processing therapy, there's 2 primary, most researched and well-known treatments for adults. And then there is trauma-focused therapy, which is for children. You're going to learn all of them within the program if you're taking the trauma concentration or the child and family concentration. And the evidence-based treatments trauma guides you through the entire. You will learn the CPT protocol by heart, and you will know exactly how to deliver the PE protocol. So again, you're going to come out and you'll learn many other skills, because there are some instances when you're dealing with complex PTSD or subclinical PTSD that you still want to accommodate techniques for those populations. So you will come out of the course ready to go with any kind of trauma. Again, let me know if you have any follow-up questions. So Erin again says that, just for information for everybody, you have to complete 1 application for the dual degree programs. Thank you, I forgot to say that. It's 1 application for a dual degree program. It just has a couple more essays, but you can combine it as a much more expedited process than doing 2 separate applications if you're applying to a dual degree program. And then you'll be sort of admitted to separately, but then the 2 programs are coordinated with each other once again. And if you're interested in the IPCR MAC dual degree program, you only need to complete 1 application. That's from Tiffany. Okay, perfect. One more question. I keep reading the question because some folks are on the phone, and so I want to make sure that they hear the question. Since this program is not heavily research-based, if we focused on research as undergrad as opposed to volunteering, will that decrease my chances of being accepted? This is a very applied program. Everything you need to know about research that helps and informs your ability to translate research into practice, you will learn within the program. So no worries, we'll be fully trained you. And it's wonderful if you come with research background, and it's wonderful if you come with a more applied background. You both add something beautiful to the conversation. And that's the important part. Again, we're looking at the whole person. We're not looking at just one item, because your whole self will be at play with every client. What kinds of settings do you see most of your graduates working in right after the graduate? I would say right after graduation, most of our students work in community mental health settings. I would say the great majority. There are some students who end up working in counseling centers or in private practices, but I would say the majority works in community mental health settings. And I would also say that we have had really great success with our students. Many of them are offered positions right out of their internships. Whether they then want them or not is a different conversation, but many of them are offered. And yes, they do very well after graduation. How does taking part in research impact your course load, and schedule? So good question. So you could do research in two ways. You could do it because you're doing it as part of a master's thesis, or for credits if you want to in other fashions, and in which case there's actually time carved out of our schedule to do that research project. You then work with an advisor. There's a whole process to get for that to happen. I would say a minority of our students chooses to do so. Now, some students do choose to have a master's thesis specifically because they want to maybe pursue a doctoral program and they want to have that on their transcript. The majority of the students who do research do in addition to coursework, partly because they want to take all the beautiful courses that are offered and don't want to miss on any, and they join more for experience. So then it really depends on your schedule, how intensively you can do so, and which faculty and which projects you might become engaged in. And so again, it could be part of your credits, up to 6 credits, or it could be outside of credits, and that's something you would negotiate sort of with faculty and so with your advisors, and figure out what might fit best your schedule, and also what might fit best your purposes moving forward. Does the program help the students secure a job after graduation or even during the program? So this is where our career development curriculum is in place. So we don't place you, we don't find jobs and give them to you, but we have 2 ways in which we help you. One is it's again, the curriculum takes you step by step in collecting, not just collecting the skills, but then knowing how to market yourself and how to really sell yourself as you are to your employers. Sometimes as counselors, we are very nice people, but we're not that good at sort of marketing ourselves. So that's a really important skill that you'll learn through the program. The other one is that we have a LinkedIn page just for our students, and we receive a lot of information about potential jobs. Once you're part of the LinkedIn page through the program, you're in it forever. And so we keep sending, I receive job postings, I don't want to say weekly, but maybe every 2 weeks. And I constantly announce them to all the students. The third way, which I just thought about, but because it doesn't happen as often, sometimes students are looking for jobs in the field while in the program, and we have ways of putting students in touch with each other. And often students who are in certain positions will help their fellow students join, find, I think the screen changed. I hope everything is okay. I hope you can hear me still. But then other students help each other locating those positions. But the program really carries you throughout it. And throughout the program, you learn all that you need to do to be able to access jobs. Let me know if I'm not answering. My screen is flashing and I'm getting a little bit distracted. So let me know if I'm not fully answering your question. It's a very good question. Some graduate programs suggest not having a job and working throughout grad school. Would you say this program reasonably allows students to be able to work on top of the course load? Yes, and it's really up to you, the pace that you want to take the program. The program is self-paced, which means that you can take as few or as many courses as you want and as you need to take to be able for the rest of your life to work. And again, you don't have to settle on a pace, and the pace you settle your first semester, the pace you're going to keep for the entire time. You choose a pace that you think is good. There's lots of advising and coaching and mentoring that goes around helping you make that determination. And then you might change your mind, and that's absolutely okay. We will work with you to modify the schedule so that you do. I would say that I want to say 100, but I'm going to be conservative and say 95% of our students work. And some students work full-time. So it really depends. If you work full-time, you're going to go part-time. If you work very, very little, you might be able to go full-time. So it really depends. If you want to do the program 21 months, then you're not going to work very much. If you want to do the program in 3 or 4 years, you can work plenty. So it really depends on your pace. You guys are great questions. How might the mental health concentration and the trauma concentration work together to prepare me for a paid position post-graduation? Specifically, what might my opportunities be in the area if I wanted to work with trauma victims in a mental health setting? So there's lots of agencies that work with trauma. Some of our students have been hired at WAR, Women Organized Against Rape, and some of our students work for victim assistance kind of centers. There's more than one in the area. Those are also our internship sites as well. And so there's lots of opportunities to work with. I would say that in most community mental health centers unfortunately, have a high need for trauma-informed counseling. Now, the mental health concentration is this umbrella concentration that allows for a lot of electives. So you might take some trauma courses, but you're not going to take them all necessarily, but you could. So I would say if you're interested in being able to work with trauma, you absolutely should take evidence-based treatments of trauma. That is the one course. If you have to take only one course, that's the course you should take. But if you want be trained in trauma more broadly, then you really want to do the entire concentration. That again is something that your faculty mentor and your program advisor will help you determine, and it will steer you in the right direction. And you might also discover, as I hope many of you will do, as you're beginning a program, you're discovering your interests and discovering your passions. So again, once you're settling on a program plan early on, there might be some changes because you're discovering new things and you are realizing that you want to add or switch things around to really hone in on your passions. Within the multicultural theme throughout our time at Arcadia, would you include the LGBTQ community as a part of that? Of course. How does your program prepare a future counselor to be able to really connect and help the community, if at all? So we prepare you for we prepare you for the world. I hope that we prepare you for the world. So I would say that race and sexual preference issues are probably the concerns and the issues that we tackle the most in terms of depth and frequency throughout the program, but we also tackle all other areas of diversity. A number of our students end up working in LGBTQ specific centers because that's their passion. Some of our students have done specific research around LGBTQ issues and actually how to serve the LGBTQ community. The Service Project Award that I mentioned was in this area. Some of the research that I showed you on the website also was in this area, so that's a big interest in the program in general. So let me know if you have any follow-up questions on that. How many weeks are the course? 15 weeks of 2 hours and 40 minutes each. We are on week 14 of 15 heading to finals. So the intensity in the program is high. I believe you mentioned that the required 3,000 hours of supervised experience for licensure is in addition to the internship practicums. When do students complete these hours? Good question. So I'll give you the full answer. If this is confusing, don't worry too much about it. The full answer is the licensure laws have the practicum and internship as educational requirements. It's just, they consider those just like they would consider human development and education requirements, just like they would consider individual therapy and educational requirements or multicultural counseling. So those are part of your coursework. The 3,000 hours, you can start them anytime past your 48th credit. But that's for Pennsylvania, because that could be very different from other states. In other states, you might have to graduate before they begin counting any of those hours. The other thing is that those 3,000 hours, but in theory, at least in Pennsylvania, you can begin accruing them anytime after your 48th credit. By your 48th credit, you're basically starting internship and still juggling your life. So most people wait to graduate to begin accruing that hours. And the other thing you want to keep in mind is that the licensing board doesn't allow you to do them in any less than 2 full years. So you, in fact, at a job accrue more than 1,500 hours a year. And so even if you could accrue a little bit over time, by the time you graduate and you have to spend at least 2 years doing it, you have plenty of hours in 2 years. So there may or may not be an advantage starting earlier. That said, you can accrue it anytime past your 48th credit. Could you discuss some job opportunities available for graduates of the IPCR MAC degree? How much is the international aspect emphasized, and what types of jobs exist in international trauma counseling pool? Good. So I'm happy to talk to you maybe a little bit more about that. The world is the gamut. I mean, there's a broad array of things that our students will do. Some of our students go on to do more international kind of base work, and they want to do so. Some of our students are much more local. What the dual degree does is that it gives you full training to be able to apply more systemic intervention when it comes to peace and conflict resolution, especially in post-war environments and countries. The program itself includes international experiences on the IPCR side, and on the MAC side it includes trauma training. So you could work with refugees, whether locally or abroad. There's a lot of global local, not just abroad local, so global issues. It might prepare you to work. Some of our students are creative and do work in various communities, applying counseling skills in sort of different kinds of ways. There's somebody who's creating a nature-based kind of mediation and treatment. It's sort of an interesting Reset Outdoors, I think is the name of the company that he's created. But I would say that it really is up to, there's as many interests as there are students in the program. So some students might be interested in psychological first aid and disaster response. Again, to some extent, you also need to know that to become licensed, you have to accrue those 3,000 hours, and those 3,000 hours are local because the licensing board will not recognize necessarily somebody who's accrued those hours elsewhere. But after those hours are accrued, then you have both trainings to be able to apply to any number of settings. And I can talk to you more. We are very reachable, so let me know if you want to chat a little bit more about that. You spoke earlier about classes being at nighttime to allow for internships work during the daytime. Does that mean all coursework is completed at nighttime? Yes. Now, to tell you the truth, when we do offer occasionally 2 sections of the same course, we always offer one at night, but on occasion there's a 1:30 to 4:10 class. But all the coursework is completed at night. Is there an opportunity to incorporate an internship as part of your curriculum as an incoming student? Soon after you arrive in the program, you are going to do a practicum, an applied experience, and then at the end of the program, you're going to do a 600-hour internship in the field. In the process, if you want to accrue additional kinds of experiences, you can do multiple practicums, or again, you can also enroll for credit in something called special projects, and there might be something specific that you want to do an internship that yields a certain kind of paper or research or some product that is very specific to your interest and enhances your curriculum as a whole. So this is also something that you would negotiate and work with, and sort of your advisor will help you make sure that you are crafting the program in a way that absolutely fits your interest. I'm interested in the MAC MPH dual degree. How beneficial is the MPH degree to the students, and what have those students gone on to do after graduation? So these are recent degrees. So I would say some students go more the counseling route, and some students more go the MPH route in sort of both traditional ways. What happens is most students want both degrees because they want to be able to have credibility in one setting with folks from the other land. So if I, as an MPH person, go into a clinical setting to implement the program, the fact that I was trained as an LPC and I have that credentials gives me credibility and allows me to implement those programs in a much more sophisticated way, and vice versa. If I am an LPC going into a MPH setting and trying to describe how the clinical knowledge is going to be beneficial to implement a certain kind of program because you don't want to implement the program in the way that you're thinking, because you're not considering all these clinical concepts and materials, then the fact that I have an MPH gives me credibility and the possibility to operate within that environment. So it really depends on what your aspirations are, and then you can figure out whether is the full dual degree what you're looking for, or is maybe one degree with a concentration, whether in community public health, for example. So that's again something that you can work with and try to figure out with your faculty mentors. And some people switch. Some people go from a concentration to a full dual degree because they realize they want so much more, or they realize the settings they want to work with really requires those degrees, or some people work, think about the dual degrees and then shrink back to a concentration. What is the difference between an internship and a practicum? Good question. So the licensure wants you to have 2 clinical experiences. One is a practicum of 100 hours, and one is an internship of 600 hours. The practicum is your first experience in the field, and it could be very much simply quote unquote, shadowing and getting a taste of what it's like, how things are run, different agencies. You might be co-leading or simply, again, shadowing groups or individual work, and you are slowly becoming a little bit more independent in implementing some of the clinical skills within the 100 hours. And it absolutely depends on whether you come in with prior experience or not. So that is sort of, that experience is an equalizer. It means that every student at the end of the practicum begins having a range of skills and also begins seeing how what you're learning in the classroom is absolutely applicable to what you're seeing in the field. The internship is a 600 hours experience. It's 2 to 3 days at the site for a 9-month period where you're pretty much going to operate as another staff member with supervision in a developmental process. You're not thrown in the day one. Of course, you're taking more and more on as the year progresses, the months go on. But that experience, you're really getting hands-on. You're doing clinical work directly with clients under supervision. Some programs tie the internship directly to the practicum directly to the internship. So you're doing a 700 hours in a row at the end of your program. We have found that it makes the conversation in the classroom so different if you're actually if you've seen the field and have tasted the field from the very beginning. So we highly recommend, and we require in our program, to do the practicum early. So you really know and have a basis from which to understand everything else you're learning in the program. Who evaluates applications? So I'm your first screening person who evaluates the application. If there's if I have any questions about the application, there's not a clear answer, then a second faculty teams up with me, and then is a whole team of faculty that evaluates the interview process. That, I would say, is almost a bigger step in some senses. And then during the actual interview, there are 2 faculty together with Carol Lyman, who's our associate director, and the rest of the faculty also can have input. So it's a group decision. There's never one person decision. So could I apply to the MAC program first and then add the MPH dual portion left after if I want that? Absolutely. The only disadvantage of that is that it's really nice to start the 2 side by side because they speak to each other, and the more you do them side by side, the more you can see the connections. But you can also start, for example, with the counseling program with the community public health concentration, and then you can decide, oh, this is exactly it, and add from there and add the second degree, in which case you would apply to the program, make sure you're accepted to the program, and then you can expand to the dual degree. I realize it's past 5, but I'm happy to answer questions for as long as there are. So I am here, so I'll keep going. How does this program feel about service to the community? More specifically, does your program encourage students to reach out to institutions that haven't yet supported practical internship before? Well, absolutely. We add to our list. I think you're asking 2 questions. I'm answering 2. Let's see if I hit them both. So we add to our list of sites that we like our students to work with on an ongoing basis. I just got information about 2 more today. At the same time, we also have preferred sites that we work for a long time, and we steer our students to some of them. It also depends on your interest for specific internship sites. Sometimes you have a very specific interest, so that leads you to a certain site. More specifically, students are also allowed to find their own sites. Sometimes they do because they know some agencies and they are really thrilled to be able to work with them. And sometimes those new agencies become part of our site, or sometimes it's just something they craft specifically for a student who built a connection with them. We also do encourage students to work with communities and do service projects potentially, and that again is part of one of the awards that we got for a group of students who got together and did that. But it could also be something you do as a special project or something that you do outside of any credits because you, with a faculty member, that you have some interest in common with them and you decide that you want to spearhead a project in that direction. Okay, I had prior undergraduate work with my local VA working under an LCSW. Do you think a local VA might support this if I enter your program? I don't know. I really would not say VAs is where we thrive. I would hate to steer in the wrong direction. We don't have a clear connection. It's very hard to get in. And again, our program at this moment does not have the accreditation that you need for the VA specifically. It might change in the future, but the VA trauma work, 100% yes, even with veterans, but I would say not the VA, not at this time. Is there a significant difference between counselors with MAC degrees and those in social work concerning and counseling with LCSW? So the difference between counseling and social worker is going to be not training you as much in individual counseling or in counseling skills. It's going to train you in thinking systemically about doing case management or connecting clients to resources. And LCSW, it's someone who has sought clinical training past their MSW. So it's sought clinical training past the hours, but it's only clinical training, is not clinical coursework. So the counseling degrees are quite different. They focus specifically on clinical training throughout your coursework and also in your clinical experiences and applied experiences. So, if you look at the curriculum, look at the social work curriculum and look at the counseling curriculum, you'll see how different they are. Beautiful questions, everybody. So I'll still be here. Okay, one more question. If I'm interested in the IPCR MAC degree, should I attend the online info session for that on Saturday as well? Oh, absolutely. Amy Cox is the director of the program. She is fantastic. You absolutely should attend the info session. You'll learn a ton from it. Yes, yes. So I'll still answer questions, but I want to say for all of you who have been so wonderful to stick with us to the end, if you're interested in a hands-on program that has a lot of multicultural training and that has close mentoring by faculty, we might be a very good match for us. So keep asking us questions. We are very reachable via email and phone, although the break is coming up, but still via email, we are all connected and we'll be happy to guide you through it and through the application process and also keep answering your question. But I'll keep answering questions now as well.